Scientists are developing a new weight loss medication that can be taken once a month. Here's what you need to know about this new treatment and medications like it. I'm Dr. Leo Lopez, a physician and scientist. You've likely heard of medications like Ozempic, Wegovy, Mounjaro, and Zepbound, the once-weekly injections for treatments of conditions like obesity and diabetes. Well, this medication that's being tested works in a similar way. But before we talk about this new specific treatment, let's talk about why these medications are used at all, why does it matter, and what we can do about it. Obesity is a long-term condition that impacts about 34% of Americans all across the country and is associated with life-changing conditions like heart disease, diabetes, cancer, and even premature death. And when taken into account with being overweight, these conditions account for more than $170 billion of medical costs every year. Now let's get to the new medication. In a recent experiment of almost 600 participants, a new once-monthly injectable medication called Miratide was found to help patients lose weight substantially. Now it's still early, it's just a phase 2 trial. But is this medication the missing link we've been waiting for to help us combat the obesity epidemic? It's not that simple. So let's talk about it. I prescribe weight loss medications like this in my clinic often, but even if this new treatment were available in pharmacies today, I'd be worried about whether my patients could even fill the prescription. And here are a few reasons why. If you wanted your health insurance to pay for one of these GLP-1 weight loss treatments, they'd likely require us to submit a prior authorization. And even though the healthcare industry recently vowed to make this process much easier, I suspect it would be denied. But let's say you wanted to pay for one of these medications out of pocket. Well, they're expensive. The list price for one of these GLP-1 medications is over $1,000 a month, with self-pay options ranging between $350 and $650 per month. The challenges don't end there. Studies show that roughly 65% of patients stop taking their weight loss medication within a year due to issues like side effects. But let's imagine the medications were affordable, they were covered by insurance, folks weren't bothered by any side effects, and were taking them as prescribed. We would seemingly have cleared every hurdle. But even if all of that was true, there would still be a major barrier for many patients. Because these medications should be prescribed as part of a comprehensive nutrition and exercise regimen. But unfortunately, 10% of Bexar County residents have limited access to healthy foods, meaning they have low income and don't live near a grocery store. And 28% of Bexar County adults are physically inactive, meaning they don't exercise outside of work. These rates here in our community are worse than the entire state of Texas and the United States. Now, scientists are going to continue to innovate and discover new treatments like GLP-1s that can help our patients live longer, healthier lives. But it's on us to do our part as well. Connect with your state legislator, your congressional representative. Ask them to support investments in science and research, and to work with industry to ensure we're making these medications affordable and accessible. Connect with your city council and your county commissioners to ensure that we've got clean and safe parks and spaces for recreation and exercise. And then it's on us to bear some responsibility for our individual health. Let's work every day to make our diet a little healthier. Let's call up our friends and family and get together to cook nutritious meals and to exercise together. And in these few ways, we can all work together to help make our community a little healthier.